No matter what aspect of dentistry we are talking about, infection control is always going to be a significant issue. That is why there are so many different infection control protocols that are put in place to minimize potential for disease transmission. It is important as a dental radiographer that you follow these protocols to protect yourself and the patient. So, the infection control basics. And what is the purpose of infection control? Simply put, it is to prevent transmission of infectious diseases. And this can be the transmission from patient to dental professional to the patient, or from patient to other patients. So, following all the guidelines that we're going to talk about in this unit will help reduce the risk of transmission. A disease-causing organism or pathogen must be present in order to have any type of disease transmission. Whether we're talking about in the dental office or any other place in the world, there has to be some kind of microorganism that causes diseases. And within the dental office, there are so many possibilities. There's your regular cold and flu viruses and bacteria. There is cytomegalovirus or CMV. There's hepatitis B and C, herpes simplex virus, human immunodeficiency virus or HIV, and Mycobacterium tuberculosis. I'm going to click through the diseases again. Mispronunciation of the last. We have the cold and flu virus and bacteria. There's the cytomegalovirus or CMV, hepatitis B and C, the herpes simplex virus, human immunodeficiency virus or HIV, and the Mycobacterium tuberculosis or TB or tuberculosis. So not only do we have to have a disease-causing microorganism, but there also has to be a route of transmission, and that can be direct contact with the pathogen in saliva, blood, respiratory secretions, or different lesions, or it can be indirect contact with contaminated objects or instruments, say saliva that you find on the table after you've taken a film and placed it in the patient's mouth. You can have direct contact with airborne contaminants that are present in the spatter or aerosols of oral and respiratory fluids. So anything flying in the air, basically. And after we have a route of transmission, there are some other factors that come into play. Different conditions. We must have one of these three conditions for one of the routes of transmission. So we must have a susceptible host. There must be a pathogen with sufficient infectivity and numbers to cause infection. So we have to have a person that is susceptible or a host that is susceptible to an infection. And we also have a pathogen that is effective enough that can cause the numbers of infection. And last, a portal of entry. So there has to be somewhere for that pathogen to get into the host, whether it is a cut on the skin, whether it is another opening within the body. That's why we wear masks and glasses. That's covering some of the openings that we have going into our body. So it's reducing the way that a disease can be transmitted. So if we have proper infection control, that should alter one of these conditions and prevent the disease. So, another example, a portal of entry. Masks, glasses, our protective clothing, those things are all worn, so that is preventing a portal of entry. Pathogen with sufficient infectivity. We are sterilizing, disinfecting, and cleaning properly. Those pathogens are not going to be as effective, or those pathogens are not going to be able to infect. I mentioned that there are guidelines that are put in place to follow for infection control with dental radiography. So, one is going to be your PPE. Always wear the protective clothing that is required for the procedure that you are doing. So, your gowns, your lab coats, gloves, masks, protective eyewear, those are always a must. You always want to wash your hands before wearing gloves and after the gloves are removed and discarded. If a glove is torn during the procedure, immediately change the glove. So hand washing is important. If that glove is torn, you'll want to hand wash again before you put on your new set of gloves. So you always wash before and after treating patients. Before, because we are trying to prevent from transmission from dental professional to the patient, just in case there is anything on our hands. And then after, because we are preventing patient to dental radiographer or dental professional transmission. And if you should have any type of open wound on your hand, you should just refrain from treating the patient. Just stop. Don't worry about, the gloves. Will the gloves protect you? They probably will, but instead of assuming a risk, just don't treat the patient until your wounds are healed. Another guideline we'll have to follow is sterilization or disinfection of instruments. And all of the instruments have different classifications. So the first classification we got to follow is a critical instrument. Those must be heat sterilized. Typically, there aren't any critical instruments used during radiography, so we don't have to worry about this as much because the examples of a critical instrument would be things that cut bone or tissue. So your forceps, scalpels, scalers, different surgical burrs, those aren't typically used with radiography, so no critical instruments to really be concerned about in this situation. The next category are semi-critical instruments. These are instruments that may have come in contact with soft tissue or bone. These are instruments that have come in contact but have not penetrated soft tissue or bone. So they should be sterilized after each use. If it can withstand heat, great. It should be heat sterilized. If it can't, then it's got to be sterilized in the proper level of disinfecting solution for a proper amount of time. An example of this for radiology would be X-ray film holding devices. They go into the patient's mouth, so they come in contact with tissue, they come in contact with saliva and teeth. They don't penetrate any bone, they don't penetrate soft tissue, so it's a semi-critical instrument. And last, we have our non-critical instruments. These are okay to be cleaned, sterilized, disinfected with an intermediate or low level infection control agent. These do not come in contact with any of your mucous membranes, so there's little risk of transmitting any type of disease. And an example of this would be your tube head, any of your exposure buttons on the control panel, and the lead apron. Moving on, we have cleaning and disinfection of the dental unit and the environmental surfaces. After every patient, you should wipe down any countertops with a germicidal chemical. The appropriate chemical to use must be EPA registered and should also be a hospital disinfectant and tuberculocidal. So it has to be able to kill tuberculosis. No matter what, we should always follow the standard precautions when we're working with any type of dental situation. Always follow the standard precautions. What that basically is saying is that we use the same infection control procedures for every patient. We don't treat anyone any worse. We don't treat anyone any better. We treat them all the same and use those standard precautions. And some various ways that diseases can be transmitted during radiographs is through the equipment, supplies, your film packets, and cassettes. And these all need to be mentioned because you have to think about the way that diseases can be transmitted. It's not necessarily direct contact, it can be indirect. If you have that cassette or that film packet and you hand it off onto somebody else who doesn't have gloves on, and they didn't know that you hadn't wiped it down or it wasn't disinfected yet, you've now transmitted that disease to that patient or that potential disease. That would be direct. Let me back up and let me rephrase that. All of these things need to be mentioned because it's important to remember the way that diseases can be transmitted. We have direct and we have indirect modes of transmission. So, if you take that film packet that you had in that patient's mouth and you place it on a countertop, but that countertop isn't wiped off, a tray is now set down on top of it and moved around to another area. That potential disease is being now transmitted from place to place to place as it touches more things. So, any one of these things can be a way that it is transmitted. And a couple different ways here that we can take care of protection before exposure. Putting all of our infection control guidelines to work, we need to prepare the treatment area. Any surface that can possibly be touched, that can be covered, should be covered. So the x-ray machine itself, any buttons that are on it, any knobs that are on it should be covered. The dental chair, the buttons should be covered. The work area, so the counter space where you have all of your supplies set up, and then the lead apron. I will say that typically in my own personal experience, the lead apron isn't usually covered. It's something that's difficult to cover, but be aware that it is something that will need to be cleaned and disinfected after use. Some additional before exposure measures. You want to prepare the supplies and equipment. What potential supplies and equipment will we have? You want to make sure you have everything in the room so that you don't have to deglove and leave the room to gather more supplies and equipment. So things you might potentially need. The film or your sensor, your PCP plate, whatever receptor you're using. The barrier envelopes or the sensor cover to go along with it. Your film holding device. Cotton rolls. And a disposable container if you are using traditional film. So you place those films in the disposable container and you can carry it to the dark room. Before exposure, you will also want to prepare the patient. So all of this is going to be done prior to washing your hands. You will want to adjust the chair. Once the patient is seated, adjust the chair. They need to be at an appropriate level so that it's comfortable for the dental radiographer to be working. You'll want to adjust the headrest. This needs to be adjusted to support the patient's head. It also should be positioned so that the upper arch is parallel with the floor. Then we have the lead apron. You also want to place the thyroid collar on. And then have them remove any objects that may interfere with the radiograph. So glasses, any piercings, retainers, removable partials, removable dentures, anything of that nature. Once the patient is prepared and ready to go, you will want to prepare yourself or prepare the operator. So this is all after patient. So after you've done all of the things on the previous slide, you will wash your hands. This should be done with soap or an antimicrobial solution. It should be, if the room is set up that way, done so that the patient can see you. This will sort of put that patient's mind at ease, knowing that you're doing your best to take care of them and protect them as well, because they can see you washing their hands. Then you will put on your gloves, your mask, and your eyewear, and then prepare the film holding device if it's still in the package. Depends on how your office is set up, depends on what type of film holding device you are using. If you're even using one at all, it could still be in the sterile package at this point. Now we're ready to begin. So these are going to be some of our infection control guidelines during exposure. You'll want to touch as few surfaces as possible. This is going to reduce the amount of cleaning time that you'll have at the end. Also, reduce the risk of indirect contamination, because once you've touched the surface, the next person doesn't know what surfaces you may or may not have touched. You'll want to handle the films with care. And this is important when you're drying the exposed films. So after each film has been taken, you will want to wipe it off with a paper towel. That will help remove that saliva. You do accidentally or inadvertently place it somewhere else, there's not as much potential risk there to transmit. When you are collecting exposed films, once it's dried, each film needs to be placed in that disposable container. And that container is used to safely transport all of those films to a dark room. And you should never put them in your pocket. 2 reasons. 1, you might forget they're there. You might forget to develop them, process them. You might have to retake them, which you're then exposing the patient to unnecessary radiation. And 2, which is kind of the obvious, is the infection control part of it. You've just removed that film from a patient's mouth, and now you're going to put it in your pocket. Whatever yuck might be on that film from their saliva is now in your pocket. So do not put it in your pocket. You want to keep the film holding device in the same workspace. So you should go from the workspace directly to the patient's mouth, directly back to the same workspace. The film holding device shouldn't be placed all around the room. And last, if you are called away for any reason, you need to place the film on the workspace in the appropriate spot. If it's contaminated, in the disposable cup. If it's not contaminated, in the workspace. And remove your gloves. And when you return to the room, you'll start the process over again, basically. Wash your hands, glove up, pick up where you left off. And then after exposure, there's still some guidelines that need to be followed. Dispose of all contaminated items. This can include cotton rolls, bite wing tabs, barriers, paper towels, anything that needs to be disposed of. Throw it away immediately so it is not moved to another space. If the patient is completely done, at this point, you would remove all of the barrier wraps that are on there as well, and they would all be disposed of. Then you would remove the contaminated film holding device while you are still gloved. Then you'd wash your hands and remove the lead apron if your patient is still there. I'm going to go back and start this slide over. I don't like the wording that I was using there, so back to the beginning. There are still some infection control techniques or guidelines that need to be followed after exposure. First, you'll want to dispose of all contaminated items. This is going to include your cotton rolls, bite wing tabs, any barriers that were used, paper towels, anything that can be exposed of, anything that can be disposed of at this point while you're still wearing your gloves. Then you will remove contaminated film holding devices, again, while you are still gloved. Then, after all of the contaminated items have been disposed of, you can wash your hands, remove the lead apron. Now, these two steps may need to be reversed because if you know that you've contaminated the lead apron, you will have to wipe down the lead apron, then you would remove your gloves, then you would wash your hands. And then disinfect any of the surfaces that were contaminated or not wrapped. Anything that was not wrapped, you may need to wipe up. And last, we have our infection control guidelines for processing the films. Now, these are going to be different, of course. If you're using digital, these don't necessarily apply. But if you're using traditional films or even the PSP plates, these may be important to follow. So you're going to transport your films or your receptors to the processing area while gloved. Remain gloved or even put on a new pair of gloves depending on the sequence of events. Remain gloved while removing films from the envelope. Now this is the film envelope. Disinfect any areas of the darkroom that may have been contaminated. Thought there were more bullet points to that slide. I'm going to go back and redo that one as well. Processing. After exposures, we would then move on to processing. And there are some different things we need to keep in mind when we're processing. And of course, this could be different if you are using a digital sensor. There's not as much processing because it's all done on the computer. But if you're using the PSP plates or your traditional film, these things are important to keep in mind. First thing is going to be transport the films or the receptors to the processing area while gloved. Then you're going to remain gloved while removing the films from the envelope, or depending on the sequence of events, you may need to re-glove before you go ahead and open up and separate the film from the envelope. And then when that's all done, you'll disinfect any area of the darkroom that may have been contaminated. And again, this should be a hospital grade disinfectant. You always want to use the hospital grade disinfectant no matter what area we're disinfecting, unless of course it's your housekeeping surfaces like your walls and things of that nature. Now to review. Which of the following is false? A. Protective clothing must be worn when taking radiographs. B. Protective clothing is worn to protect against infectious materials. C. It must be changed weekly. Or D. It must be removed before leaving the office. Correct answer is C. It must be changed weekly is false. Protective clothing must be changed daily or when visibly contaminated. Number 2. When taking a dental x-ray, gloves A. Do not need to be worn. B. Only need worn when handling chemicals. C. Only need to be worn while exposing the radiograph. Or D. Must be worn during exposure and processing because you could be in contact with saliva. The correct answer is D. It must be worn during exposure and processing because you could be in contact with saliva. Number 3. Hands should be washed A. Before seating the patient. B. After seating the patient. C. After seating the patient and after making any chair adjustments and placing the lead apron. Or D. When you wash your hands isn't important as long as you wash them. And the correct answer is C. After seating and after making adjustments. And last, cleaning and disinfecting the treatment area is done with an EPA registered disinfectant that is labeled A, hospital disinfectant and tuberculocidal, B, hospital disinfectant only, C, tuberculocidal only, or D, none of the above. And the correct answer is A, hospital disinfectant and tuberculocidal.